Is the ketogenic diet effective in treating obesity? Well, let's first talk about what does the ketogenic diet consist of. The ketogenic diet follows a high-fat, moderate protein, low carbohydrate eating pattern that contrasts with most healthy eating guidelines. Carbohydrates can be found in a variety of foods including fruits, vegetables, whole grains, milk, and yogurt. Carbs from all sources are strictly limited on a keto diet. Ketogenic dieters avoid bread, grains, and cereals in order to keep carbs below 50 grams per day. Even some of the fruits and vegetables are restricted since they contain carbohydrates. Carbohydrates are our body's primary source of energy. The body breaks down fat into ketones when there aren't enough carbs for energy while maintaining lean muscle. The ketones subsequently become the body's main source of energy. The heart, kidneys, and other muscles rely on ketones for energy. Ketones are also used by the brain as an alternative energy source. Some of the short-term health risks include nausea, headaches, fatigue, and dizziness. This is referred to as the keto flu. Some individuals also have difficulty sleeping. Constipation can be caused by limiting high-fiber vegetables, fruits, and whole grains. Keto dieters frequently need to take a fiber supplements to keep regular as many nutrient-dense vegetables and fruits are eliminated in order to reduce carb intake. Although almost all vegetables are allowed to be consumed in the ketogenic diet other than the starchy vegetables such as potatoes and corn. Now let's discuss what is obesity. Obesity is a treatable disease that is linked to having too much body fat. It is a global health concern. It's caused by a combination of hereditary and environmental variables, and it's tough to manage alone with food. Obesity is defined as a body mass index (BMI) of 30 or higher, as determined by a healthcare provider. Obesity affects over 40% of Americans. Causes of obesity include psychological factors, imbalance of calories, sleep deprivation, appetite signals, hormones, genetic factors, prescription factors, and environmental factors. Excess weight can have a negative impact on our entire body. Obesity and excess weight are linked to more than 50 health issues. There are numerous treatment methods available, and a combination of them is frequently used to manage obesity. Correlation between a ketogenic diet and obesity. Despite the fact that the exact prevalence of insulin resistance and obesity is unknown, it is very prevalent. Obese people were the first to show that insulin stimulation of glucose absorption could cause resistance. Now, what is insulin and insulin resistance? Insulin resistance is the body's response to excessive sugar. Insulin is a hormone that aids in the detoxification process. Its purpose is to prevent blood sugar levels from rising too high and cleansing the body of excess sugar. Our body doesn't need much sugar, and too much sugar can be very harmful. The preferred fuel of the body is fat, not glucose. The body's natural preferred fuel is fat, which is a far cleaner fuel. Fat-burning procedures, ketones as a byproduct. A ketogenic diet can aid with weight loss as well as a variety of other health issues over time. Insulin resistance is characterized by a reduced ability of muscle cells to absorb circulating glucose, as well as a reduced ability to limit hepatic glucose production. Individuals with insulin resistance, on the other hand, have a core problem with metabolizing dietary carbohydrates, and they will transfer a greater proportion of it to the liver, where it will be converted to fat rather than oxidized for energy in skeletal muscle, therefore suggesting that the beneficial effects of very low carbohydrate diets in obese subjects are not just a function of weight loss, but also of improved glycemic control, hemoglobin, A1C, and lipid markers, as well as reduced use or withdrawal of insulin and other medications, which occurs in many cases before significant weight loss. In isocaloric studies, people with insulin resistance have significantly better markers of metabolic syndrome than people who ate a low-fat diet. A present study conducted the long-term effects of ketogenic diet in obese patients. The study included 83 obese patients, 39 men and 44 women, with a BMI more than 35 kg per meter square and high glucose and cholesterol levels. Before and after the ketogenic diet, the researchers measured body weight, BMI, total cholesterol, LDL, also known as low-density lipoprotein, cholesterol, HDL, high-density lipoprotein cholesterol, triglycerides, fasting blood sugar, urea, creatinine levels. The changes were measured after 8, 16, and 24 weeks. The results were promising. The patient's weight and body mass index greatly decreased. From week 1 to week 24, overall cholesterol levels dropped. After treatment, HDL cholesterol levels climbed dramatically, whereas LDL cholesterol levels reduced significantly. After 24 weeks of treatment, the level of triglycerides had dramatically dropped. The level of blood glucose dropped considerably. The variations in urea and creatinine concentrations were not statistically significant. Overall, ketogenic diet proves to be a good tool for treating obesity. A low-carb ketogenic diet for a period of time may assist to regulate hunger and increase fat oxidative metabolism, resulting in weight loss and therefore a good tool for treating obesity. It performed well in treating obesity and other health issues compared to many other diets, including a low-fat diet. Although it is true that the ketogenic diet is a very strict way of eating, new types of ketogenic diets are now available that include meals that resemble carbohydrate-rich foods, and this may increase diet adherence. One should still make sure to take vitamins and supplements to maintain the body's overall health state. The current study demonstrates that the ketogenic diet can be used for longer periods of time than previously thought. However, research is extremely limited and was only performed on a small group of people. Like many other diets, it is likely that people will go back to their original ways and the results will go away. However, compared with other diets, in low-carb keto diet, ketones become the main fuel source of energy, resulting in suppressed hunger and reduced craving, making it easier for people to stick to it for a longer period of time once adapted to the new eating patterns. Since simple carbohydrates are easily consumed for energy by the body, resulting in faster rise in blood sugar and pancreatic insulin release. Insulin resistance, which is high level of insulin, is an underlying barrier when it comes to losing weight. With the presence of insulin, you're not going to lose weight as it acts as a dominating fat-storing hormone. Every time you consume carbs, your insulin spikes greatly, preventing you from losing weight. Pure fat and fiber, including non-starchy leafy greens, don't spike up your insulin levels. Low carbohydrate diet is a better diet when it comes to losing weight. Most diets include lots of sugars and carbohydrates, which can cause insulin resistance and a massive amount of inflammation and bacterial overgrowth in your gut. What to eat during meals while doing the healthy keto diet? For breakfast, you can have some eggs, avocado, cheese, bacon, nut butters such as almond butter or peanut butter. For lunch, you can have meat, 3 to 6 ounces, with vegetables or salad on the side with olive oil and vinegar. Also try to include nuts and seeds. For dinner, you can have fish or seafood, salad, and fat bomb. Another meal option includes chicken with skin, asparagus, and olives. Overall, when trying to lose weight in obesity, a healthy keto diet is one of the best ways to do it. When you eventually get into the ketogenic diet and adapt to it, your cognitive function, memory, skin, weight, and heart will all greatly benefit. Your cholesterol levels may go up temporarily because your fat cells releases it. However, they will eventually come down along with the other side effects that are also temporary. Important things to remember is that it can take 3 to 5 days or longer to fully keto adapt. The way to know you're in ketosis is if you don't crave anymore. If you have cravings for bread, then you need more B vitamins. It is important to consume vitamins, especially electrolytes, B vitamins, and nutritional yeast while on the ketogenic diet. A healthy keto diet makes your body run on ketones rather than glucose, which causes your body to directly target your fat burning mechanism, helping you lose fat in a healthy way. It also gets rid of cravings and hunger, improves memory, mood, malabsorption, and promotes healthy insulin function, allowing your body to heal and restore to your natural insulin.